Today's Mondays in March, we had an opportunity to look at four things really. We looked at some of the accomplishments that we've had over the past year, with the high points being opening 2 new hospitals and a successful joint commission survey, as well as a very successful evacuation of the John Sealy Hospital when there was a fire, and everybody did such a tremendous job. We also talked about the Best Care Initiative and all that we are doing in order to make sure that our patients have the best experience, each patient every single time. Third, we talked about the clinical strategic plan, what it was in this draft plan, and how that activity can help make us better positioned to be successful in the future, because we need that success in the health system and in the faculty group practice in order to make sure that we have the funds to be able to support our education and research missions. And then lastly, we talked about the activities, major activities that we have going forward in this year, everything from magnet re-verification for nursing to continued growth of the League City campus. In the end, I had a few key takeaway messages for people. The first one is that our growth makes us more relevant. It makes us relevant both to patients who are going to have to absorb more of the cost of their care, and it's going to make us relevant to payers who are looking for great opportunities for their enrollees to be able to get excellent care at an excellent price. We also said that best care makes us more competitive. The better we are in terms of our cost and quality, the more attractive we are to anyone who would want to receive care here or contract with us. We said that the clinical strategic plan provides us with intense focus and a future direction that's needed in order to make sure that we thrive as an organization. We also emphasize that success is only possible through teamwork. The teamwork here at UTMB, I think, is unparalleled, and we need to continue to do that. We need to continue to ask ourselves, is there someone else who can help me here? We need to continue to ask ourselves, what can I contribute? Because then and only then will we have real teamwork, and that's going to be a huge factor to our future success. And lastly, I wanted to emphasize that despite all the challenges that we read about today in healthcare, and despite the pressures that we face in terms of declining reimbursements, accelerating costs, we are well positioned. We have a very challenging future, but we have a bright future. And I want people to remember that as you think about the history of UTMB. We have been through a lot in our years, and we have always come out on top. Our future is very bright because we have the experience, the culture, and the teamwork to really be able to make this work.
UTMB Health, working together to work wonders.